Action.
Hi, my name is Stephanie. I'm going to be your nurse today.
Hi.
Close the door for privacy. I'm going to wash my hands. May I see your ID bracelet? Can you tell me your name and your date of birth?
It's Maggie So Rye, 9/20/93.
Okay. Patient stated age matches appearance. How are you feeling today?
Doing well.
Any pain or discomfort?
No.
Okay. Patient's mood matches affect. No presence of illness. Good overall hygiene and symmetrical face. And no drooping. And speech is intact. Any allergies?
No.
Do you know what day it is?
Today's Tuesday.
Tuesday, and do you know where you are?
University of Detroit.
Okay, and do you know why we're here?
We're doing a physical assessment.
Okay, patient is alert and oriented ×4. So I'm going to be doing a health assessment on you today, okay?
Okay.
I'm going to start at the face. Color is appropriate for ethnicity. No redness, no lesions. Sorry, my hands are cold. Skin is warm, dry, and intact. If there were lesions, I would check for ABCDE characteristics. Face is symmetrical, no drooping. So first I'm going to start with your eyes.
Okay.
Look up. Okay, conjunctiva are pink, and eyes are symmetrical. I'm going to look in your eyes.
Okay.
Can you just stare at my nose?
Sure.
Okay, and can you follow my pen?
Mm-hmm.
Okay, great. Pupils are equal, round, reactive, and light accommodating. And now I'm going to look at your mouth.
Okay.
Lips are intact, no lesions. Can you open your mouth for me? Okay, oral mucosa is pink without any lesions. Tongue is pink and has no lesions. Teeth are white and evenly spaced, no presence of cavities. And tonsils are bilateral +0. And can you say uvula retracts and it's midline. Okay, thank you so much. And I'm going to check your sensory. Can
Okay.
you tell me where you feel?
Forehead, left cheek, nose.
Okay, great. Can you raise your eyebrows above your cheeks yet? And smile. Cranial nerves 5 and 7 are intact. Okay, now I'm going to palpate your carotid arteries. Can you turn this way, please? Okay, turn this way. Okay. Carotid arteries are equal in strength and bilateral +2. Now I'm going to listen for bruise with my bell. Okay, can you turn this way again? Excuse me. Okay, no bruise are heard, and now I'm going to listen to your heart, okay?
Okay.
I'm going to just move your hair a little
Yeah.
bit. Thank you so much. Okay, start in the aorta. Pulmonic. Herbs. Tricuspid. And mitral, where I would hold for 1 minute for apical pulse. Okay, now I'm going to follow back up with my bell for any murmurs.
Okay.
Okay, no murmurs are heard. And now I'm going to listen to your lungs, okay? I'm going to start from the front, from the interior. Oh, and S1 sounds are heard loudest at the apex, and S2 are heard loudest at the base. Now listen to lungs. Can you just breathe out when I press down?
Mm-hmm.
Okay. And listen to 8 places. Okay, can you lift your arms? And this arm. Okay, breath sounds heard in anterior and lateral, no adventitious sounds. Now I'm going to listen posteriorly in 10 places.
Okay.
breath sounds heard in all 10 places, no adventitious sounds. Now I'm going to take your anterior to posterior diameter. Okay, it is 1 to 2. And now I'm going to palpate your coastal vertebral area for any pain. Can you tell me if you feel any pain or tenderness? No. No. Okay, can you lean forward towards your toes? I'm going to assess the spine. Spine is a line, no S-shaped or kyphosis, and is midline for the back. Okay, now I'm going to listen to your bowel sounds. Do you mind laying back and lifting your shirt to show your teeth? Okay, I'm going to listen to all 4 quadrants. Okay. Starting in the right lower. Okay, bowel sounds heard in all 4 quadrants. If not, I will listen for 5 minutes. Now I'm going to assess for pain. Can you tell me if you feel any pain or tenderness? Okay, this is the right lower quadrant, and there is the appendix and right ovary. Okay, the right upper, which is the liver gallbladder. The left upper, which is the spleen and the stomach. And the right lower, which is the left ovary and the left spermatic cord. Okay, stomach is flat, umbilicus is center, skin is warm and dry. There's 1 lesion, but it doesn't go against ABCDE characteristics. No cyanosis or discoloration of the skin. Okay, you can put your shirt back down. Thank you so much. Can you sit up?
Yes.
Now I'm going to look at your arms. Okay. Arms are warm, dry, and intact. Color is appropriate for ethnicity. No redness or cyanosis. There's 1 lesion, but it doesn't go against A, B, C, D, or E. Can you flip your arms over? I'm going to feel for your brachial pulse. Okay, brachial pulse is bilateral +2, and now going to feel for your radial pulse, which is also bilateral +2 and equal. And I'm going to look at your hands. No clubbing of the hands. Capillary refill is less than 3 seconds. Nail beds are intact. Can you grip my fingers? Okay, equal strength. Okay, now I'm going to move down to your legs. Okay. All right. I'm looking for edema. No edema. Skin is warm, dry, and intact. No lesions. Color is appropriate for ethnicity. If there were lesions, I would check for ABCDE. And I'm going to feel for the tibial pulse. Tibial is bilateral +2 and equal in strength. And now for the pedal pulse. It's bilateral +2 and equal in strength. And now I'm going to look for capillary refill. Capillary refill is less than 3 seconds with no clubbing. And now I'm going to do a test on the bottom of your foot. Okay. Trying P7. Okay. Negative for Belinsky. Okay, can you stand up for me? Oops, that's a pretty great. Can you put your feet hip distance apart, arms to the side, and stare right at me? And now can you close your eyes? Okay, negative for Romberg. And can you walk there and back? Okay, can you sit down?
Sure.
Did you feel any dizziness when you got up?
No.
No? Are you in any pain?